folks. It's Friday, March the 26th. Good grief, March is just about over with. And just like they say, with March winds comes spring. I really hope that's true. It's pretty windy out there. Doesn't feel real springy, but it's going to be warm this weekend. So, a few things to talk about today. I know many of y'all were really disappointed to get Tim's email and learn that we're not going to be able to do a year-end incentive, the one that we do that's based on the profits along with some quality measures. That was disappointing. We knew that 2020 was going to be a hard year because of the pandemic and so much changes in the patient services that we were able to render. So we were braced for that, and indeed, it once we got the books all closed out and everything, and we did our UDS report, the reality did sink in. But I kind of sort of have some good news for you. You know, you've probably been hearing on the news about the American Rescue Act, which is the next round of stimulus funding out of the Biden White House. And there's a bunch of money in that Rescue Act that is targeted for FQHCs, us, community health centers. And the really important thing is that we're going to be able to go back retroactively all the way to the middle of January 2020 and use those grants funds to offset expenditures that we had back in time, as long as we hadn't already used other grant funds for that. So there's a slim possibility that we may be able to make some adjustments when this grant is made available and come out with a little bit better bottom line number for 2020, December ending. We'll see. No promises, but little glimmer of hope. But don't forget, the UDS quarterly incentives are still out there. As a matter of fact, in 2020, we did over $157,000 worth of those incentives. That's done on a quarterly basis, and we're going to continue that. I know that they have not been easy to achieve because we haven't been able to have patients coming in as frequently to the office. Patients are still very reluctant to come in and get care. So I understand the problems with that and that they are not all that easy. But like I said, in 2020, we did disperse 157,000 for those quarterly UDS incentives. So they're happening, and I hope that helps some. We'll just see. I want to pivot now and talk a little bit about vaccinations. So last week, all together in our vaccination clinics, we gave 1,116 first doses and 1,110 second doses. Now, if you're adding that up in your head, that's 2,200 vaccinations that we gave last week. It was a busy, busy week. We have noticed some slowing down this week. It's kind of like a saturated market almost. Those folks that really wanted the vaccine, and especially since it opened up to include anyone over the age of 18 with various conditions like hypertension, diabetes, even a BMI over 30. So we've gotten a lot of vaccinations done, but we still got a lot more to do. John Douglas provided me some data, and I kind of got to look at it. So, based on all the folks who are eligible for vaccination right now, according to the guidelines in our area, there's 107,207 of those. 107,207 of those 207 of those folks. But only 37,796 have actually been vaccinated. You can see the gap. There's a lot of people out there who still need vaccination. Out of all those that have been vaccinated, though, that 37 some odd thousand, we've done about 28% of those ourselves. So we have really stepped up to the bar on this. But we've got an awful lot of people that still need vaccines. We're going to kind of be redesigning our Mobi deployment over the next few weeks and see if we can't really get into um, some of these very rural areas by going into churches, going into Dollar Generals, if they'll let us go into the parking lot, various gas stations, service stations, places in rural communities where people kind of go. You know, I live in a rural community, and until the gentleman died, the little country store right across the street, you could always count on there being 4 or 5, 6 people in there, sometimes spending all day. But, you know, so there are places like this throughout our community, and we have to find them. We need to deploy our Mobis and we need to get them out. We need to get shots in the arm. It's the only way, frankly, at this point, that we can see a clear pathway to getting this pandemic under control. Speaking of getting the pandemic under control and our own Care South Carolina campaign, remember our herd immunity campaign, we're still working toward getting 110 more staff vaccinated. We're still working on our records. The week hasn't quite closed out yet, but so far I think there's actually been at least maybe 3, 4, or 5 more staff that have gotten vaccinated. It's a little bit, but it's a start. You know, I understand, and frankly, there is a lot of discussion about this in many more settings than our setting about this issue that folks are calling vaccine hesitancy. It's kind of like, I don't know if I'm really ready to get the vaccine. There's a lot of surveys that have gone out. I've talked to some people. I hear a lot of folks that say, well, I want to wait until the next single dose shot comes out, the Johnson and Johnson comes out. I understand that. But I don't have any good news for you on that. I don't know when there's going to be access to the Johnson and Johnson unless you currently find a rural private pharmacy in some of your hometowns. Those pharmacists have received, or they should have received by now, if they got on the DHEC list, some of that initial wave of Johnson and Johnson supply. So you might want to kind of scout around and check into that. I really do hope that we get the Johnson and Johnson one way or the other, either through DHEC for our Mobis specifically, or like I mentioned last week, we have been approved for getting direct shipments from HRSA. We just don't know what those direct shipments are going to be or even when they're going to start. We're going to do everything in our power to really push for the Johnson and Johnson because it's time. We will still be able to get DHEC Moderna vaccine, but we really need this Johnson and Johnson for a lot of reasons for our Mobis and also for the folks that are really kind of waiting on it to move forward. The other thing that folks tell us are they're worried about the side effects. Well, you know, there has been an enormous amount of effort from CDC to really look into this. There have been over 55 million vaccines now done nationwide. Think about that. That's a lot of vaccinations that have taken place. There are two reporting systems, one called VAERS, VAERS, and the other called VSafe. Now, VAERS has to get reports from the folks who are doing vaccinations. Like if we had a, a reaction to a vaccine, we would have to report it via the VAERS. And by the way, although we've had some people faint from just having an injection, you know, people faint all the time from getting a shot. We have had actually no adverse events from the vaccine itself. Now that's us. We've done over 13,000 vaccinations. The other way is the VSafe. Now, VSafe is available to anyone who has received the vaccine. You can go Google it. You can join up with this reporting mechanism. I did, and it tracks. For the first week, you'll get a text almost every day and say, "How are you doing? What's going on? Is your arm sore? Are you having any other um, impact or anything?" And they're bundling all that data together. I know you're hearing about folks that say, "Man, it hit me hard on that second dose. I stayed home with fever and flu-like symptoms and chills and so forth for a couple of days." I understand that. I hear that. But man, oh man, I'd rather have a couple of days of feeling pretty yucky than having COVID. Seriously, people. Even the folks that have been asymptomatic with COVID, there are reports that are coming in now, long time after they've tested positive, and although they've been asymptomatic, there are reports coming in now that now people are beginning to have some problems. So, yeah, well, a few little side effects, the flu like symptoms, maybe even some fever, chills, and so forth. But people, it is much better than having this COVID disease. So we know that side effects are on the radar screen. I know that people, there's been a lot of surveys done, are also concerned about the newness of the vaccine, and they go, it was just developed too fast. Well, I've spoken about this before. I'm not a clinical person. I did some research. I talked to other clinical people, including our state epidemiology folks. It was fast, but it was fast because in vaccine development, there are various tracks that have to be done, various processes involving numbers of people. And usually it goes one step, and then the second step, and then the third step. That didn't happen this time. A lot of things ran at the same time, concurrently. That's how they could manage to roll this out. Plus, the platforms upon which this vaccine are created and were developed were already there. They already knew how to do a lot of this. So it wasn't like they had to reinvent the wheel on a lot of this vaccine development. So, with 55 million vaccinated people out there, I think by now we probably know if we had some really, really, really serious problems. Then there are folks that say, "Well, I don't know how effective it's going to be. This effectiveness, is it really gonna help?" Well, yeah, there's more data gathering. And at first they were saying that the Pfizer and the Moderna vaccine had about a 95% effectiveness. Now they're saying even with those new variants, and folks, I'm really scared of those new variants. They come out of South Africa or Great Britain. I'm really scared of them. That the vaccine still has a great deal of effectiveness and at least prevents severe disease, that it avoids hospitalization and avoids death. So, it's even more reason. The variants are out there and they're coming. They're beginning to spread quite a bit in South Carolina. So the effectiveness is there, not perfect. Yeah, we may have to get booster shots down the road. We have to get a flu vaccine every year. So, I wouldn't be a bit surprised if something like that didn't develop with the COVID vaccine. But I don't know about y'all, but I'm willing to do almost anything. I want this pandemic under control, and I know you do too. The PD is in what's called, Department of Health is called in the cold spot right now. We've been called a hot spot before because there were so many infection rates, so many cases popping up, and frankly, so many deaths. But now things have really cranked down, and we're actually what DHEC is calling a cold spot in the state. But we can't say that the pandemic is over, even with being in the cold spot. We're being warned that surges could easily happen, especially after spring breaks and when folks start saying, "Oh, it's going to be so good to be able to get out and go to the beach and what have you." And I know we're all tired of being in, but this pandemic is not over yet. So get your vaccines. Come on, people. Let's give away 10 of those $500 gift cards from Visa. Let's do this. Let's get CARE South Carolina herd immunity. We can do it. Remember what I said last time. Talk to folks. Um, check it out. Check out for yourself. But let's get vaccinated. And by the way, don't forget, you get vaccinated, you get a free Krispy Kreme donut. You can go every day if you wanted to. I mean, just saying. But all right. Um, I think that's about it for today. We're coming up on Palm Sunday this Sunday, and then we're entering into Holy Weekend next Friday. You got a holiday. Yay. So let's all take a deep breath. Let's do what we need to do, be who we need to be, and be ever, as we always are, CARE South Carolina strong. Y'all take care. Bye bye.